Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your face in the video. As a reminder, after the pep talk, please take the online learning comp evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate like this one shown here. I have placed the link in the chat box already. Another reminder, obtaining 25 OLETE certificates will entitle one mentee to a voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback for this particular pep talk in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video, show your faces now. Ready, set, 1, 2, 1. Nagpahabol na ulit. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. May 17, 2025 of this year marks the start of year number 5 for the ROJoson pep talk. How long the pep talk will last will depend on the enthusiasm, discipline, and perseverance of both you and me. My pep talk today is entitled Thyroid Physician Specialist, Who to Consult. The empowerment objective is for the lay people to have an essential understanding on thyroid physician specialists who to consult as part of their health management. It's important for everybody to know this particular topic because in the future or even now, you may have some thyroid problems. You must know who to consult. The contents of this particular pep talk will be the following. What are the different types of physicians treating thyroid disorders? Given a list of physicians who are known to have training in treating patients with a thyroid concern, how do you choose which type of physician to consult? And then, what is a thyroid physician specialist? And then, ROJoson thoughts, perceptions, opinions, and recommendations on thyroid physician specialist. Disclaimer, this pep talk will contain my thoughts, perceptions, opinions, and recommendations, or TPORs, culled from my personal experiences as well as from the writings of other health professionals. Let's start with the first topic. What are the different types of physicians treating thyroid disorder? So if one has a thyroid concern or any concern for that matter, any concern regarding the thyroid, whether it's a buccal or hypothyroid symptoms, hyperthyroid symptoms, weight loss, etc. So what type of physician should one consult? Here is a list of physicians who are somehow trained to treat thyroid disorders. Number one, an endocrinologist. This is a physician who has training in the medical management of thyroid diseases. Medical management in the surgical, okay? Endo. A general surgeon who has training in head and neck surgery, including thyroid surgery. A general surgeon who has training in head and neck surgery, including thyroid surgery, and who has a well-rounded training in thyroid diseases, inclusive of medical management. I will explain the difference between these two. A general surgeon who has training in head and neck surgery, including thyroid surgery. The other one who has a well-rounded training in thyroid diseases, including medical management. A head and neck surgical oncologist, a graduate of a fellowship training program under general surgery specialty, who has training in head and neck surgery, including thyroid surgery. There are about 4 programs in the Philippines. So you might hear of a title, head and neck surgical oncologist under of a general surgeon. Now the other category of physicians who somehow are trained to treat thyroid patients is an ENT or otorhinolaryngology head and neck surgeon who has training in head and neck surgery, including thyroid surgery. And then there's another type of surgeon, head and neck surgical oncologist, a graduate of a fellowship training program under ENT specialty who has training in head and neck cancer surgery, including thyroid surgery. There is 1 program in the country. So the difference between the head and neck surgical oncologist in the ENT is it's the one developed by the ENT specialty, and the other one is by the general surgery specialty. So magkaiba, no? Magkaiba in terms of who are responsible for developing it. No? They belong to the different specialties. A nuclear medicine specialist who has training in radionuclear scanning and radioactive iodine therapy for thyroid diseases. So you've heard of patients receiving radioactive iodine therapy and who are the ones administering this. So one of them is nuclear medicine. An endocrinologist can also do that. A radiologist who has training in radiologic diagnosis of thyroid diseases. And then a pathologist who has training in the pathologic diagnosis of thyroid disease, yung nagbabasa ng mga slides ng mga specimen of thyroid gotten from the operations. A physician who has training in the needle biopsy of the thyroid. And then a general medical practitioner who has basic training in thyroid diseases. A family medicine practitioner who has basic training in thyroid diseases. And lastly, a complementary and alternative medicine or CAM physician who has training in general in thyroid diseases. So here is a list of at least 13 types of physicians with training in thyroid disorders. Marami sila. So if one has a thyroid concern, what type of physician should one consult? As I said, there are at least 13 types of physicians with training in thyroid disorders to whom one can consult depending now on the situation, on the need, and also on the want. So these are the 3 factors that will determine where to go to. Okay, so which one of the specialists to choose? So depending on the situation, on your situation. So newly discovered thyroid concern with unknown diagnosis yet. This is one situation. Kadidiscover lang yung thyroid problem ng isang pasyente. Seen already, nakita ng ibang doktor who have training in thyroid concern, and the patient wants to have a second opinion. So, saan siya pupunta? Seen already by a physician who have training in thyroid concern and want to change physician for one reason or another. Baka hindi niya nagustuhan yung unang doktor, so lumipat siya. And then there are other situations that can be present. Then depending on the need. So the need of this is being recommended for a procedure such as a biopsy, ultrasound, operation, radioactive iodine therapy, etc. So note a second opinion on the need can still be done. Need to have a long-term surveillance and follow-up. So these are examples of need circumstances. Then depending on your want, if you want a thyroid specialist or contented with a general practitioner who have basic knowledge on thyroid, your trust on the physicians to whom you want to consult, popularity and reputation of the physicians whom you want to consult, your budget, your insurance if you have, and then, of course, the fees of the physicians is another consideration. Your residence distance or proximity to the physicians you want to consult, your convenience to go to a thyroid specialist, others. So these are circumstances under one. So you have the situation and then the need and the want. So depending on this, then you choose which type of physicians you want to consult. So a word on thyroid physician specialist versus general practitioner physicians. First of all, we define physician specialist as a medical doctor who has completed advanced training and certification in a focus, a specific area of medicine, allowing them to diagnose and treat specific conditions or patient populations with a high level of expertise. So there's the connotation, the implication here, if you are a physician specialist, may advanced training, and then focus area of medicine, not generalist, and then high level of expertise. A thyroid physician specialist is a medical doctor. So we'll now define a thyroid physician specialist. Kanina, define ko yung physician specialist in general terms. So now the thyroid physician specialist is a medical doctor who has completed advanced training and certification on thyroid disorders, allowing them to diagnose and treat specific conditions or patient populations on thyroid with a high level of expertise. A thyroid physician specialist can be one who is comprehensive in scope in the advanced training or focus in one specific limited area in the management of the thyroid disorder. So pwedeng comprehensive yung scope of training niya or nakafocus lang siya sa isang maliit na area in the management of thyroid disorder. So examples of thyroid physician specialists who are comprehensive in scope in advanced training will be the endocrinologist and the surgeons. Unless yung surgeons ay nakafocus lang sa operasyon, hanggang operasyon lang, then you call these surgeons limited or focus ang kanyang specialty. Now, examples of thyroid physician specialists who are focused on one limited aspect in the management of thyroid disorder will be the radiologist doing thyroid imaging. Hanggang doon lang siya, yan lang gagawin niya, hindi niya ititreat yung pasyente. The nuclear medicine specialist doing radioactive iodine therapy, nag-administer lang siya ng gamot sa mga patients with thyroid disorder, hanggang doon lang. And then pathologist doing needle biopsy, ganun din. So yung pathologist tatawagin para magbasa ng ng mga specimens, no, that given to them by the surgeons. So these are examples of physician specialists who are focused in one limited aspect, in contrast to those who are comprehensive in scope in advanced training. Mas malawak ito. So now let's define general practitioner physicians. General practitioner physicians are those who can treat thyroid disorders. Okay. So these are the primary care physicians, usually also they call themselves family medicine physicians and complementary alternative medicine physicians. So under these categories, at least klase, yung general GP, general physicians, family medicine physicians, and the complementary and alternative medicine practitioners. So their competencies are at basic level, yung advanced level, basic level lang. No? So these are for the general practitioner physicians who can treat thyroid disorders. When to see a general practitioner physicians for your thyroid concern? When there is a newly discovered thyroid concern with no specific diagnosis yet. So pwedeng pumunta muna sa isang general practitioner as being advocated in the health system in the Philippines as well as abroad. Ako ng first physician to consult will be yung general practitioners. Kasi bago lang, hindi pa natadiagnose ng maigi. But note here, in the Philippines and some countries, you have the freedom to go directly to a thyroid physician specialist with comprehensive expertise right away, bypassing the general practitioner physicians if you want to get high-level, expert level of evaluation and treatment. So pwedeng i-bypass, pwedeng dumiretso sa thyroid physician specialist without going through the general practitioner if you really want to have a expert level of evaluation and treatment. Once there is a specific thyroid disorder diagnosis, which needs intensive and long-term treatment, consult a thyroid physician specialist with comprehensive expertise already. Yan ang next step. Usually either an endocrinologist or a general surgeon with comprehensive expertise in thyroid disorder, not just operation. So note the training of the general surgeon is usually comprehensive, not just limited to thyroid surgery. The general surgeon can manage the hormone problems of a thyroid patient. So these are some of my thoughts, perceptions, opinions, recommendations on thyroid physician specialists. I may be biased because of my training background. I'm a general surgeon with head and neck surgery expertise and experience. So go to a thyroid physician specialist once you have a thyroid concern. That is, if one is available in your community. Kung wala, just go to a general practitioner's physician. So because when you go to a thyroid physician specialist, you get an expert level and direct to the point management. Second, TPOR will be go to a thyroid physician specialist who has comprehensive expertise in treating thyroid. One may consult an endocrinologist or a general surgeon who has a comprehensive expertise in thyroid management, not just operation. Okay. So most of the surgeons, general surgeons, have comprehensive expertise in thyroid management. I will show you the reasons. See curriculum of the general surgery. So this is, even abroad, the Cleveland Clinic define general surgeon as a doctor and a surgeon who is trained to care for the whole patient. Hindi lang yung specific area, patch-patch lang, the buong pasyente in all ways necessary, including surgery, medical and surgical, pwedeng gawin ng general surgeon. They diagnose and manage a broad array of medical conditions before, during, and after surgery. So preoperative, operative, and post-operative. So example, a patient with a surgical condition, no, gagamutin niya before the operation, including the medical problems, mga preparations, and then operahan, and then gagamutin niya, lagaan niya after the operations. So this is the definition of general surgeon by the Philippine Society of General Surgery. Ito yung mga sa local specialty organization dito sa Pilipinas. So it emphasizes the presence of training in developing comprehensive skills in diagnosis, preoperative, operative, and postoperative care of patients with different diseases. One of them is the head and neck, kasama sa thyroid yun. No? So malawak yung training ng general surgeons kasi kasama yung mga alimentary tract, abdomen, breast, vascular system, endocrine system, skin, and soft tissue. So a PSGS certified general surgeon with thyroid surgery specialty has a comprehensive skills in the diagnosis, preoperative, operative, and postoperative care of patients with thyroid disorder. Thus, a general surgeon is trained to do medical treatment of thyroid disorders as well. If surgery is recommended by an endocrinologist, a general surgeon or an ENT who does thyroid surgery will be referred to. A general surgeon and an ENT are qualified to do operations on the thyroid. If a needle biopsy is needed, this can be done by any of the following as long as they have the expertise, as long as they are trained to do that, to do a particular, to do needle biopsy. So example, endocrinologists, as we said, they are usually trained in the medical management, but there are some endocrinologists who train in doing needle biopsy. So pwede, basta they are certified that they can do it. General surgeon, okay. And then ENT, then pathologist then, dati-dati nagbabasa lang. Some of them are trained to do needle biopsy. And then radiologists also, some of them are trained to do needle biopsy. If ultrasound is needed, this can be done by any of the following as long as they have the expertise. Radiologists, this is the usual domain of the ultrasound, radiologist or ultrasonographer. General surgeons, may mga general surgeons who have ultrasound machines, they can also do ultrasound of the thyroid. ENT, ganun din. There are some who have ultrasound machines who can do that. Endocrinologists, kuminsan, meron din sila. Pero mas bihira itong endocrinologist. No? Ang pinakamadalas, radiologist. If radioactive iodine therapy is needed, this can be done only by any of the following as long as they have the expertise again. Nuclear medicine specialists, endocrinologists. The radioiodine therapy kasi kailangan isang radioactive substance, iodine substance, which has to be procured from an agency, and with the agency only recognized nuclear medicine specialists and endocrinologists. But these two will have to apply for the license also. The following can be considered as the main pillars, the main thyroid physician specialists. So you have the endocrinologists, general surgeons, and ENT surgeons. The others can be considered as ancillary thyroid physician specialists, such as nuclear medicine specialists, radiologists, and pathologists. There are so many main thyroid physician specialists with different competencies and qualities. Here are some personal guides. This is my personal opinion in choosing an excellent main thyroid physician specialist. So my recommendation, ating guide ko, one who has comprehensive knowledge of thyroid disorders. Comprehensive means from the causes, the etiology, and then how to diagnose, how to treat, okay? Kung pwede, right now, medical as well as surgical management, okay? Then number two, who does accurate physical examination of the thyroid and neck. Dapat kasama ito. Marami kasi hindi nag-examine ng pasyente ng leeg ng pasyente. Then who correlates the clinical findings and laboratory and imaging findings, not just relying on the laboratory. No? So importante ito. No? So ito yung personal guideline ko. Can do accurate physical examinations and then who can correlate. And then for the surgeons, kahit surgeon siya, doesn't mean that opera lang siya ng opera, who can also treat patients medically as well. And then who gives explanation and advise patients and relatives on findings, diagnosis, and options. Then for the surgeons who operate on the thyroid with skills, magaling mag-opera. And then lastly, who practices minimalist, value-based, and patient-centered care management approach. So these are my personal guidelines on choosing an excellent thyroid physician specialist. Okay, so which can be an endo, which can be a general surgeon or an ENT surgeon. But you have to know the more specific competencies of this main thyroid specialist. So summary and takeaway in this particular pep talk will be the following. I have discussed what are the different types of physicians treating thyroid disorders. As I said, there are at least 13 types of physician specialists treating treating thyroid disorders. And then given a list of physicians who are known to have training treating patients with thyroid concern, how do you choose? And what is a thyroid physician specialist? And then what are my thoughts, perceptions, opinions, recommendations of thyroid physician specialists? Takeaway in relation to patient empowerment, be always in touch with reliable medical information on thyroid physician specialists, who to consult. Knowledge is power. It gives power. Use the 4Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on thyroid physician specialists, who to consult as part of your health management. So with that, I end my pep talk today. Thyroid physician specialists who to consult. I hope I have empowered you to have an essential understanding on this particular topic on how to choose a thyroid physician specialist as part of your health management. Before we go to the Q&A portion of the session, reminder, please take the online learning evaluation test exercise for Master of Learning and have a perfect score to get a certificate like this. I have placed the link in the chat box. And then obtaining 25 or letter certificate will entitle one mentee to a voucher for a ROJoson medical consultation, either face-to-face or telemedical. And then another request will be to type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the QA and interaction. Please turn on your video now, show your faces. Okay? Ready? One, Pabon? Dorly, okay. One, two, one, two, three. Okay. The floor is now open for questions, comments, suggestions, sharing of experiences. or short consultations. Pwede rin. So, how many have experience having issues on how to choose a thyroid specialist? I suppose before this lecture, hindi niyo alam kung sinong pupuntahan, di ba? Okay. Sinong Senny Cabral?
Dok,
Bakit sa akin, Senny?
satisfied na, may peace of mind na po ako ngayon dahil nagpa-check up ako sa inyo last Tuesday. Ano?
Yeah. Lakasan mo lang. Pwede?
Nagpa-check up ako sa inyo last Tuesday.
Kaya nga.
Pinapaan niyo po yung leg ko. Kaya thank you po, Doc.
Kaya nga, bakit ako pinili mo? Bakit hindi ibang doktor?
Siyempre po kayo po on the best doctor.
Pero bakit alam mo yung specialty ko yung thyroid?
Eh, sa mga pep talk po natin, mga nagsishare po ng mga story.
Okay. So, hindi ka na pumunta ng endo, hindi ka na pumunta
Hindi na
ng
po.
ENT.
Ever since, Doc, hindi naman po ako nagpa-check up sa iba ng ano, lalo yung mga oncologist. Ano. Sa inyo lang po.
Okay. So, parang ako na yung family physician mo. All around
Yes
na
po,
ako.
Doc.
Okay.
Yes po.
Sige.
Thank you, Doc.
Okay. Pero ako, I can consider myself as a thyroid specialist because I'm a general surgeon. May training ako dyan sa thyroid. No? Okay. At I have 44 years of experience na sa thyroid. Okay. Okay. Anybody else? Cha, would you like to share your experience? Cha? Cha Concepcion? Are you around? Yeah.
Hi, Doc.
Yeah. Ano yung before when you got your thyroid problem, ano yung concept ng sinong pupuntahan? Sinong ano?
Actually, Doc, at first talaga kasi, ako confused. So, second opinion kita. So aside dun kasi, Doc, sa mga specialist, so, ang factor kasi sa akin is, dapat compassionate din. So, isa po yun, Doc, sa mga reason kung bakit sa inyo po ako nagstay, magpa-check up, and hanggang tuloy-tuloy na po. Tapos nirefer niyo ako sa, sino nga ba yun? Radioactive. Tapos nirefer na ako sa endodoc. Doon na-confuse na naman ako kasi ba't niya ako nire-refer, galing na ako sa'yo. Pero hindi ko na siya sinunod. Kasi nga po, Doc, mas trusted kita.
Okay.
So yun, so sa'yo na ako nagstay, being compassionate doctor, and talagang kahit anong oras po, anytime, Doc, pwede kayong makontak. So yun po ang aking mga reason.
Yeah, okay. Secondary na lang yon. Yung unang-una, yung kung sino ang thyroid specialist, no? So you can see that even among doctors, magulo di ba? Hindi nila alam kung sinong thyroid specialist, no? Yeah. Kaya yung mga pasyente, hindi rin nyo alam. So, hindi rin nyo alam kung saan kayo pupunta, di ba? Okay.
Opo.
So, yung...
Saka yung Doc, yung sa special, years of experience nyo as a thyroid specialist, hindi po yung factor.
Yeah, pero sa umpisa, baka hindi naman nyo alam hindi nyo kilala, di ba? Yung year of experience, no? So, yung title lang tinitingnan ninyo. So, kasi kami, yung general surgeons, no, we call the also officially title namin general surgeons. We don't usually put a parang subtitle na head and neck surgeon. Unlike sa ENT, meron
Mm-mm.
silang ENT, head and neck surgery, di ba? Okay. Kaya, kaya yung mga pasyente, kasi thyroid nasa neck, di ba? Nasa leeg. So, tendency sabihin, etong ENT, head and neck surgery, pupuntahan ko kasi neck ang problema ko. Di ba? Okay. So, yung iba naman, okay, sabihin nila, pupunta muna kami sa endo. Endo ang usually ang ina-advertise na thyroid specialist din, no? Sabihin nila, baka pwede namang sa endo na lang para di ako operahan kaagad ng surgeon, no? Ganun din, no? Okay. But usually, we have to remember also that pag sinabi mong general surgeon or surgeon for that matter, head and neck surgeon, hindi naman lahat ng pasyente pupunta sa kanila, operahan nila, no? So, ideally, dapat ini-evaluate nila kung kailangan ng operasyon o hindi, no? Of course, there are some surgeons may bias sila, medyo gusto nila opera ng opera, di ba? Okay. So, importante yung surgeon na marunong mag-decide, no? Okay. Na kung kailangan operahan o hindi. Kung di kailangan operahan, huwag operahan, no? So para may ethical concern, nagre-respect ng ethics, no? Okay. Okay.
Yes, Doc.
Okay. So napunta kasi kay radioactive iodine for radioactive iodine, no? So,
Opo.
so the mere fact na ni-refer ka sa endo, hindi siya, ang expertise lang niya hanggang RAI lang. Di ba? Okay.
Yes, Doc.
The reason why siya lang pwedeng magbigay ng RAI, siya lang kasi may license doon. May training. No? Okay.
Yes.
So, ako, I cannot go into that training anymore. Di ba? So, siya lang may lisensya eh, no? From the
Yes, Doc.
ang tawag doon DNR. Kalimutan ko na yung departamento noon, no? Okay. Who can give the license? Yung endo, meron din silang lisensya, no? Pero kami wala kaming lisensya, no? Parang sa mga ibang cancer 'yan, no? Okay. Although let's say breast cancer, no? Kaya hindi ako pwedeng magbigay ng radiotherapy kasi wala akong machines, di ba? Di ba? Kung may machines lang ako, bibigyan ko, di ba? Saka wala rin akong training doon, kaya nire-refer namin kayo sa radiotherapy, di ba? Okay. So when you say specialist, it doesn't mean that he knows everything, no? Mas yung aking ina-emphasize comprehensive, no? Comprehensive. Hindi siya ibig sabihin na he knows everything at hindi rin niya kayang gawin lahat, no? Example, we have the pathologists, yan na expertise na nagbabasa, no? So as a specialist, let's say thyroid specialist, no? So hindi ko kayang basahin yung sa microscope yung specimen unless mag-special training ako, no? Okay. So which is aabotin ako ng mga kung ang aking training ngayon is 5 years, baka abutin ako ng mga 10 years bago ako masyadong mahaba na yun, no? So radiologist, ganun din, no? Usually pinapasa namin sa ibang radiologists who have the expertise to read. Pero pag after reading, yung mga radiologists, hanggang dun lang sila. No? So they ask the clinicians on what to do next. Sila nang bahala. No? Okay. So tandaan nyo, when we say specialist, no? Walang specialist na who can do everything. No? Basta importante, who can do most of the thing at ma-identify lang kung anong pwede niyang gawin, kaya niyang gawin, at may comprehensive knowledge, no? On how to treat the patients. Kung di na kaya yung gamutan ng i-refer niya sa isang specialist na focus yung niya, expertise niya. No? Okay? Okay. Anything else, Cha?
Okay na, Doc. Well explained na po.
Okay. So anybody else want to share the experience? There's a question. I thought in the chat. Yeah. Si Baby is to
Dok, okay
tanong.
na, nasagot mo na kanina. Tanong ko lang po
Okay.
kung bakit pati ENT nagtitreat ng ng thyroid. Pero nasagot
Okay.
mo na kanina eh.
Sa lecture ko, kasi,
Ah,
oo. Kasi ENT
thank you, Doc.
may training din sila, no? So
Ah,
dati-dati wala. Dati-dati wala,
mm,
no? Hanggang
mm,
ENT lang sila dati, no? Ear, nose,
mm.
and throat, no? But over the years, pinasukan na nila yung thyroid, no?
Okay,
Nag-training
okay po.
sila. Kaya may mga matatandang ENT, hindi marunong mag-thyroid. Yung mga bata, yung mga bagong generations, no? So,
Opo.
kaya nagta-thyroid surgery na rin sila, no? Okay. Any more?
Thank you, Doc. Thank you, Doc.
Yeah, you're welcome. Sino pang may mga thyroid concerns? O may ano? Jeng, napunta ka ba sa ibang na-expose ka sa ibang aside from me?
Wala po, Dok. Kasi 'di ba yung pong nag-check up sa akin no na meron akong thyroid. Sigurado po ako hindi po kasi niya expertise yung kaya siya po ang nagsabi sa akin mismo na maghanap ako ng doktor na pwede kong pag-check upan ng tungkol sa thyroid. Since then po naman, alam po naman po na nagtitingin kayo din bukod sa breast ay sa thyroid. Sa inyo ko na po inano yung concern ko tungkol doon. Kaya diretso na po sa inyo. Tapos po, di ba po, nung last time na nagkasakit ako na dito ako sa Cavite nagpapa-check up, sabi ko sa inyo, yung endocrinologist na nagtingin sa akin, parang hindi ko yung check up niya kasi parang natakot ako na sinabi niya na pag lumaki ka agad yung mass na nasa yung thyroid ko, baka daw operahan ka agad. Pero nung nagpa-check up naman ako sa inyo, yun nga po, yung sabi po ninyo, yung explanation nyo sa akin na hindi na bakit ako magpapa-opera yung ultrasound nga po yung anliliit lang po nung nakikita na mga bukod tapos wala na nga po kayong maapa. Kaya po, hindi na din ako sa kanya bumalik. Sa inyo na rin po talaga ako nagpatingin. Hindi na po ako talaga bumalik sa iba. Ganun
Okay.
po.
Okay.
Natakot
Um,
lang ako sa kanya.
Oo.
Yung explanation niya hindi ko nagustuhan. Kaya siguro po talaga sa amin katulad ng mga patient, kung sino na talaga yung gamay namin na doktor, kung pwede nga lang pong lahat ng pwede ipa-check up sa inyo na. Kung lahat alam ninyo sa inyo na po.
Di ko
Hindi na
kaya.
kami pupunta sa ibang doktor, Doc Hoson, sa totoo lang. Talagang mas maganda po talaga na kung sino na yung trusted na physician na doon ka nagpapa-check up, doon na lang kayo. Kasi talaga pong yung trust ninyo sa amin at yung trust namin sa inyo, nandun na po siya, buo na. Ganun. Kaya
Okay.
nagpapasalamat po kami mga patient ninyo kasi nandyan po kayo na laging natulong sa amin. Tapos, yan po, lagi pong marami kami natututunan sa pep talk na ginagawa natin every Saturday.
Okay. Okay, thank you for your trust. No? Okay, but I have to say that I don't know everything, but I'll try my best to help you. No? Okay. So, yung mga ibang hindi ko kakayanin, siyempre, kasi may basic skills ako as a doctor, di ba? Basic, no? So, ida-diagnose ko muna bago ko yung ililipat, no? Kung palagay ko, you need the expertise of somebody else, no? And then, tutulungan ko pa rin kayo na i-refer, paghanap, no? Kung sinong pwedeng tumingin sa inyo, no? Ganon, no? Okay. Anybody else who wants to talk, who want to share their experiences? You still have 2 minutes. Nana? Ano pa? Ano pa bang sasabihin natin? Yung issue dito, sa thyroid pa lang ito, di ba? Yung topic natin sa thyroid specialist, no? Yung mga questions ito, applicable sa lahat ng ibang topic. Let's say breast. Sino bang breast specialist? Di ba? Sino ba yung cardio sa heart disease? Di ba? Sasabihin niyo, sino ba yung cardiac specialist? Sa cardio, may cardiologist na adult, may cardiologist na bata, mayroong yung mga nagbabasa ng 2D echo, yung iba, mga gumagawa ng interventional cardiology, yung mga, when you say interventional, may mga procedures na ginagawa, di ba? So iba-iba, ang dami, di ba? So ang daming klase yun, no? So sa ngayon, ang hirap maghanap na kung sinong pupuntahan, no? Okay. So, mas maganda kung meron kayo isang family doctor who can advise you properly, no? Okay, entrusted doctor na lang, no? Mahirap kasi maghanap na ngayon kasi kanya-kanyang linya na, no? At hindi pa niyo kilala, no? Okay. So, okay. Any more? So, if there are no more questions, who wants to have the last comment? Nana? Kung wala na, we'll call it a day, no? So we'll see each other again next week, no? Okay. Okay? Bye-bye.
Okay, thank you, Doc.
Thank you po.
Thank you, Doc.
Bye-bye po.
Bye-bye.
Bye-bye.